Hey there, my name's Chris, and today in this video we're going to be reviewing the proper procedure to obtaining a wound culture. Now you can use this video to brush up on your skills, as well as prepare for the upcoming skill validations that happen every year. Without further ado, let's go ahead and dive right in. The equipment that you'll need to obtain a wound culture is a syringe, antiseptic swab, a culture tube, as well as a culture swab, dressing supplies, clean and sterile gloves, goggles and a mask, and a gown if needed. The first thing that we want to do is verify the physician's order. And then we're going to perform the beginning 5, which is to assemble your equipment, knock on the door, identify the resident, explain the procedure and provide privacy, and perform hand hygiene. After performing hand hygiene, you're going to go ahead and put on clean gloves, goggles, and a mask, and you can put on a gown if needed. Then we're going to remove the dressing carefully and dispose of it in the biohazard. After the wound is exposed, we're going to go ahead and remove and dispose of those gloves, perform hand hygiene, and apply clean gloves. And then you can clean the area around the wound edges with an antiseptic swab. You want to wipe from the edges outward, removing any old exudate. Then discard the swab and remove and dispose of your soiled gloves, and once again perform hand hygiene. Then we're going to open the packages containing sterile culture tube and dressing supplies. You can go ahead and apply your sterile gloves. And next we're going to obtain the cultures. There's 2 types of cultures, aerobic and anaerobic. Now most bacteria can grow in oxygen, and they are called aerobic bacteria, and they're usually found in wounds close to the skin surface or superficial wounds. Bacteria that cannot grow in the presence of oxygen, anaerobic bacteria, they're usually found in deeper wounds and in abscesses. To obtain an aerobic culture, we're going to take the swab from the culture tube and identify a 1 centimeter square area of clean wound tissue. Then you're going to moisten the swab with sterile 0.9% sodium chloride solution, and using the swab, apply light pressure to the identified area, and then rotate the swab to try to produce exudate. Then remove the swab from the wound and immediately place it in the aerobic culture tube. You can then wrap the outside of the ampule with gauze to prevent injury to your fingers, and crush the ampule of medium size and push swab into the fluid. Now, unless a skin culture is ordered, avoid swab contact with the periskin to prevent wound contamination from normal skin flora. Once the sample is collected, you can then label the tube with your proper name, the source, the date, and the time collected. Then you're going to perform the ending 5, which is to remove your gloves, perform hand hygiene, leave the resident comfortable, place the call-out within reach, and then document where and when appropriate. Then you'll document the wound culture obtained and the condition and the appearance of the wound.